Okay, welcome everybody. My name is Kyle Magatelli. I am the webinar coordinator for the Health Professional Student Association, the publishers of the Student Doctor Network. And thank you for joining us for our Doctor's Physical Therapy webinar with Allison McKay and MeMe Ernest-Stanley. Thank you guys for being here.
Hello, thanks for having me. Us.
So before we get started, I want to talk a little bit about what the Student Doctor Network does. We have some slides here. Quick resource overview. So Student Doctor Network provides free resources for pre-health and professional health school students. Check out studentdoctor.net. You're going to find everything there. Next slide, please. So the Student Doctor Network forums, we have robust communities in a variety of different, pretty much every health professional field. We have a pre-physical therapy forum, physical therapy forum. If you're a student looking to get into this field, those are great places to go to talk to other students who are walking that same path, as well as professionals and providers who are engaged in the community as well. Next slide, please. Confidential expert advice. I've used this myself. If you have a question, go there, ask questions. Experts in those fields who are verified will be able to answer those questions effectively and promptly. It's a great resource. It's all anonymous. Next slide, please. And how-to admissions guide. So there's a how to get into physical therapy school. I think we can all agree that getting into a professional health school, extremely challenging. This is a great place to go, start with, to find out from step one to when you're all done. You're going to be able to find out that information in one concise guide. And I believe that's all the slides we have. So that's enough out of me. I'd like to have you guys introduce yourselves. Please tell us a little bit about who you are and what you do.
Well, my name's Allison. Allison McKay. I am a physical therapist. I currently work at the Cincinnati VA Medical Center. I'm from Maysville, Kentucky. Been a physical therapist for going on 3 years now. And and I am also a board certified specialist in geriatric physical therapy.
Cool.
And my name's MeMe Ernest-Stanley. I'm a physical therapist as well. I'm originally from Fort Wayne, Indiana. I went to PT school at the University of Cincinnati and then met Allie during a residency. And I'm a board certified specialist in neurologic physical therapy.
Okay, wow, cool. Well, right on. So, hey, why don't we get to the questions? Everybody watching, please type in your questions so that we can get those answered for you as well. So when did you first decide to become a physical therapist and why?
Yeah. I first heard of the profession of physical therapy when I was in 6th grade. I played soccer and I had knee pain, so I went to PT. And I just thought my PT was the coolest guy. He was from England. He was obsessed with soccer. I was obsessed with soccer. And I was like, man, I could be a PT one day and work with professional athletes. And that's what I wanted to do. And then in high school, I tore my ACL and I got to experience physical therapy again. And it was a really good experience. And that kind of, made me be like, yeah, this is definitely something that I want to do. And I initially went to undergrad for athletic training because it was a bachelor's degree at the time. And now it's a master's degree. I did that because I love sports and I thought it would help me prepare for PT school. It was a good choice for me. And I love what I do.
Oh.
Cool. Well, I grew up in the world of physical therapy. My mom, Julie, was a PT. So I always grew up knowing what outpatient physical therapy was like. Of course, she did her best to try to encourage me to look at other fields, but just born with that passion. So she's kind of the reason that I went into this field and chose to pursue it. And I graduated from UK exactly 29 years after she did, which is super cool. So that's kind of where I got my start.
Cool. Right on. Okay, so next question we have, what's a typical day like for you guys?
You can go first.
Okay.
This one, come on, weirdo.
Well, I just actually started my position at the Cincinnati VA, so still getting into the swing of things. I think when we think about a typical day for a physical therapist, you have to consider that there are different settings. So we're in hospitals, we're in skilled nursing facilities, we're in outpatient clinics, we're in sports clinics. So each therapist that I talk to has a completely different mind frame or a completely different like day-to-day look. So some of them are working with athletes on getting back to their sport, and some of them are working with the older population, the geriatric population, on simply getting up out of bed. So some of those days you're seeing 2 patients at once and interacting those patients. Sometimes it's a one-on-one treatment session. And the overall goal, of course, is getting, helping someone be able to perform something better, whether it be by reducing their pain or just improving their movement. And that's kind of what our normal day is trying to help people move better and feel better.
Yeah, I'm a little bit of an oddball. So I work as a treating physical therapist in University of Cincinnati's Neuro Recovery Lab. So essentially when they're trying to do these trials or figure out what the best intervention is for someone, we do the research. So someone writes up the protocols, and then I use my clinical judgment on implementing the protocols to work with people. And mostly in our lab, we work on people who have had strokes. So for me, my typical day is I go into the lab and I see probably 3 to 4, sometimes 5 participants who come in for the studies. And then I teach a little bit in UC's health science programs and the DPT program undergrad and in their Masters of Athletic Training. So on the days that I teach, I might see 1 or 2 people and then go in and teach in the afternoon. It just kind of depends on the semester and how many people or participants we have in the studies at a time.
Cool. So this next question is from Abby Laughlin. I like this one, so I'm throwing it up now. Some of your favorite opportunities and jobs you've had as a PT.
That's really cool.
That's so good.
He's the best.
So MeMe and I actually came to know each other during residency. Residency is optional in the physical therapy field, and it's completed after you obtain your doctorate of physical therapy. So I would say doing the residency through the VA is probably the best experience that I've had so far in this field. It has opened up my eyes to how different each of us are able to accomplish the same goals. And then also just being in a community of other physical therapists that are like-minded, that want to get better and want to grow and learn beyond that being in school. So I think that, just being a part of a community that's connected to each other and helps each other out and builds each other up, that's definitely something you find in the physical therapy community for sure.
I loved my residency too. Some other opportunities that I've had with my dual degree in athletic training, I work with Team USA Wheelchair Rugby, so I get to go down to Birmingham, Alabama a few times a year, and I'm the ATPT with them, and I work with the head of their medical team, and it is a lot of fun. If you guys don't know about wheelchair rugby, you should look it up. It's most people who play have spinal cord injuries, but they're in like sport chairs and they get to run into each other, and it's great because, like I said earlier, I love sports. But then during PT school, I also fell in love with neuro because I love the nervous system. And adaptive sports are like that perfect mix of people who typically have a neuro impairment and they're athletes. That's something cool that I've gotten to do so far.
Interesting. All right, cool. So next question, can you talk about what your experience was like applying to DPT school?
Yeah. So for me, there's different ways that PT schools are set up. Some of them you can get an undergraduate degree in 3 years and then start that clinical doctorate in your 4th year. And they have like a direct admit process as long as you maintain a certain GPA. Where I went to undergrad, I got a 4-year degree and then I went to a different school to get my doctorate. And applying was tough. So I was fortunate that the year that I applied, I got in, but I was waitlisted at multiple places. And when it comes down to you're graduating from your undergraduate program and it's April and you're not sure if you're going to school, it can be pretty stressful. But a lot of it is figuring out what prerequisites, what courses different programs want. so that when you apply, you have a complete application. And that information can be found on PTCOS, which is like a big hub, and it has all the information of the different accredited PT programs on it. But applying it was good, but it can also be stressful. But in the end, it worked out.
Yeah.
So.
Yeah, PTCAS is where you actually submit your application. I'm pretty sure that, at least this is what I was told, you don't want to start your application until within a year that you're going to apply, or it'll reset it after a year. So within the year that you're planning to apply to PT school, you can get on there. You can look up any of the PT schools and what their requirements are. So you can get on there beforehand. Just don't start your application until you're within a year of applying. And they usually have all of the application deadlines in there. Each school is different on their deadlines and their announcements, but that's a great resource. And I know Kyle also mentioned that how-to guide on with them too, and that's also something that can be really helpful. But staying organized, making sure that you're looking at the prereqs early on in your undergraduate, that way you're not scrambling during your senior year to get the requirements.
Yeah, and I think to add to that, I do think it opens August 1st. At least it did, I think, when we were applying. But it's pretty straightforward on PTCOS. It's not super confusing or anything. And a lot of the, they have a typical essay or two that you would write, and then some schools require like a secondary essay. Some schools require the GRE, some don't. Again, that's something you can easily look up. And some of them, like the clinical hours, so you have to get observation hours. And most of the time, they want them in two different settings. So a lot of people will do like the typical outpatient setting, and then some of them want an inpatient setting so that you know what physical therapy looks like in an acute care hospital or in a skilled nursing facility too. And the amount of hours that programs need depends. I think UC wanted 40, and I think Pitt, when I wanted 200. So it just kind of depends. And like Allison said, it's good to kind of start getting those earlier on so you can enjoy the experience. And when it comes time to submit the application, you're not like super stressed out.
All right, cool. So this next question dovetails nicely since you talked about being waitlisted. Militz Norio is wondering, did you have any backup plans just in case physical therapy didn't work out? That's a good question.
I'll answer that one. So I was fortunate that I could get my undergrad degree in athletic training, which is another profession. So I would have had a job to go to, or could have gotten a job in that if I wanted. That was my backup plan. I also applied to some masters of athletic training programs that I got into, but I really wanted to be a PT. It just depends too on what your undergraduate degree is in, I think.
Yeah, I got my bachelor's in exercise science. So of course I definitely looked into, okay, what am I going to do with this bachelor's if this doesn't work out? I think it's really important to reiterate that if you don't get in your first try, you can try again.
Yeah.
And there are ways to improve your application. Reach out to the schools. Each school usually lists like someone in their department that's going to give you like solid advice about your application. So don't just blanket say, oh, well, this grade was low, I probably need to get it up. Like reach out. What was it that you needed to improve? And a lot of these schools are going to tell you, you need more hours, you need more involvement, you need improved grades. So don't hesitate to reach out to those people. I would say about 50% or more of the class that I was in did not get in the first time that they applied. And it was the second or third. And that can be really discouraging. But if this is something you truly want to pursue, then you go for it and you try again.
Yeah, I think I know quite a few people too who either planned a gap year or they took a gap year. And during that time, they redid classes, but then they also got jobs as like an aide in a PT clinic or at a hospital, which is super beneficial because we talk to patients all day, and you need to have some like hands-on skills to be able to make sure people are safe. And when you work in that job, that's something that you pick up really easily. That's definitely an advantage going into school.
Yeah, for sure.
Cool. So next question, running along that thematic line. In your position now, knowing what you do, what would you say to yourself back when you started?
That's a good one. I think that it's worth it and everything's going to be okay. Like I said, And undergrad, I did a lot. I'm one of those people that often overcommits. So I was super stressed back then doing all the things that I did and then trying to wait to get into PT school. But it is truly all worth it. It's a lot of hard work, but it prepares you for the profession, I think, and to enter the real world once you're done with PT school.
Yeah, I think going into, if I were to go back and do it differently, I would be a little bit more open to the specializing after PT school. Right now, the profession is kind of moving towards an area where, you become a generalist through school and then you can choose whether or not to specialize afterwards. And I definitely was not open to that while I was in school because it was so challenging. It was so hard. And, you're fighting to learn all of these things and trying to make sure that you got everything covered. And the thought of going to even more school after that, I mean, you've done 4 years of undergrad. Sometimes people do more, and then you're on to 3-4 years of PT school. And the thought of continuing that path is really intimidating. But it's definitely made me a better therapist. It's shaped me into a better person as far as being able to manage multiple things at once. It's taught me a lot of new skills. So definitely being more open to that specialization process. I think I would have said that to myself.
Cool. Next question in that case, how did you choose your area of specialization?
You go first.
So I kind of fell into it. So I was on one of my clinical rotations, my second one. So I still had more didactic work or classes, and then had 2 more rotations after that. And I was working in a skilled nursing facility at the VA. And they started talking to me about specializing in geriatrics, which is treating patients over the age of 65. And at first, again, very intimidated, did not think that I was one that was going to go over and above. But talking to them, they kind of convinced me, hey, at least apply for the residency, see how it goes, go through the interview process. And of course, now I wouldn't change it for the world, but definitely really intimidating. But being there in that skilled nursing facility, just surrounded by the sweetest veterans that absolutely are so grateful. And I think really just the gratitude that the older population has and the respect they have for each other and for others, I think just really drew me to specializing with them and taking my focus towards them for sure.
Cool.
I chose mine initially because when I was in undergrad, I helped host the Special Olympics. And a lot of people who have an intellectual disability often have some type of neuro impairment too. And that was kind of when I was like, I wonder what these people do for exercise. And I'd never seen anyone really working in neuro. So that's where I kind of got interested in that. And then like Allie said, we met during our residency at the Cincinnati VA, and I couldn't recommend a residency anymore. I love it. It was so great. Really good mentorship. You can really get to dive in to the area that's the most interesting to you. And that's kind of just, I chose it. Initially, I was going to do a residency, but then by like second or third year PT school, I was like, I don't know. And I was like, oh shoot, personally, I was like, oh, let's get it. Yeah. Initially, I was like, let's get it done now. But I wish you can do it right after you graduate from PT school. You can wait a few years. It doesn't really matter.
Yeah.
Cool. All right. From Laura Turner, what are some common career paths for DPTs?
Yeah. So there are so many options.
So many.
I think that's what is one of the benefits to this career is you can be in an outpatient clinic, meaning that the clinic's set up and the patients come to you for XYZ problem. You can be in the sports clinic. There are physical therapists that work with professional teams. There are physical therapists in the military. And where I was in like the skilled nursing facilities. So people who need short-term rehab, they've been in the hospital, they need some rehabilitation in order to be able to go home safely. So that's where I was for that one rotation. There are also physical therapists in the hospitals, and they're helping dictate, okay, so this person's medically ready. They've addressed what the reason they came in here for. Can this person get home safely? Do they need any equipment at home? And then there's also physical therapists that come into the home and treat there as well. So you'll see often, or you'll hear if someone has a total hip replacement or a total knee replacement, there's physical therapists that will follow them into the home. They'll have their surgery. They'll go home within a day or two, and the PT comes in their home, gets them moving, gets things going. And then that way there's not a gap in care, and they can progress and get back to doing what they were doing before.
Yeah. You know who we always forget about is the pediatrics, peds.
Oh, peds.
You can work in pediatrics too. That's another area of specialization. So in pediatrics, you can work in early intervention, which is if you have a kid, I think under 3, it depends on the state. You go to the baby or the toddlers or the kid's home and do physical therapy to help them kind of meet their motor milestones. Physical therapists also work in schools with a lot of different kids for whatever reason that they need PT in schools. There's people who are pediatric sports therapists. What's another area I forgot? Oh, there's pelvic health. So that's people who maybe they work with postpartum women or pregnant women. Sometimes they work with men too who are having pelvic floor challenges. And there's electrophysiology is another one.
Yeah.
That's very rare. I've never met anyone who specialized in that, but those physical therapists do a special training. I believe they can do like EMGs. And I think that's it. We got neurosports, ortho, Jerry's, peds, women's health. Oh, the oncology is another one. That's a newer specialty where you can do a residency in that or take the specialty exam. And that one is super neat. And the people who I've met who work in oncology, it's very rewarding.
Yeah. And there's even physical therapists that work with hospice care too. So trying to coordinate with families to help them care for their loved ones at end of life. So they always used to say in physical therapy school, like, you're going to see physical therapists that are there from life until death. And we really work across that spectrum because when it comes to mobility, when it comes to being able to get around and do the things that you need to do and want to do, that's kind of where we step in our role is to be those movement experts and get people back. So kind of starts from a young age all the way until the end, for sure.
Cool. So follow-on question that fits right in. How do you work with other healthcare providers like occupational therapists?
We love the OTs.
Yeah, I love working with occupational therapists. Our occupational therapists are, of course, also in a variety of different settings. I've worked with an occupational therapist in the outpatient setting. She was a hand specialist. There's often times when you're in the skilled nursing setting or the hospital setting where you have an occupational therapist there with you while you're evaluating or treating that patient, and they're helping you with ideas on their ADLs and activities of daily living. ADL is activities of daily living. But they're there to help you and support you, and they bring a lot to the table. And it's awesome when you have someone there that's bringing a whole different perspective, because they can hit things that sometimes it just totally breeze over and you forget about. So definitely collaborating with them. There's several opportunities to do that, and I absolutely love the OTs, the occupational therapists that I've gotten the chance to work with.
And then we do a lot of coordination with physicians. Like if a physician sends one of their patients to us, we have a lot of discussion with the physician on progressing and deciding when to clear someone, if it's to get back to a sport. PTs work a lot in the sports setting with athletic trainers, which massage therapists, nutritionists, and then of course team orthodox too. So a lot of collaboration, and that's the way we like it.
Cool. And we got a question from Abby Laughlin that I wanted to get to. Is there anything you would like to see the world of PT improve upon, shift their mindset about?
So loaded.
Mimi's loaded with this.
So loaded. What a loaded question. Yes. So I think some people in the PT profession chronically underdose patients, whether that's an ortho and they're giving someone 3 sets of 10, and that's not really going to help strengthen the person or help them meet their goals. Same thing happens in the neuro world. We don't push our patients enough. It can be scary to push someone with a stroke or spinal cord injury, but it's really necessary to help that person get better and to use some neuroplasticity or to help the brain with the rewiring that it needs. I think that I'll stop there on that because I could keep going.
Yeah, there's definitely everyone treats so differently. So it is kind of hard to compare sometimes, but definitely underdosing is something I see in the geriatric physical therapy world, where someone can get up and walk around their house, yet they're being told to do seated marching. So lifting one leg and then the other, which is, for some people can be a really challenging task. And if it is challenging, absolutely, that's the way to challenge to build up strength and endurance. But for others, it's pretty easy. So definitely, I think that is something that I think there is a shift that is progressing. And then another positive progression and shift that I've talked with my mom again about going from, the progression of how much education you get now. It used to be a bachelor's degree, progressed to a master's, and is now the doctorate. And that doctorate has that piece of the research behind it, and making sure that we're practicing things that are evidence-based, not just things that have been told to us, but things that are proven through the literature, proven through research, and making sure that, we are interpreting that data and not just like taking it for granted. And utilizing that and actually applying it in our treatment sessions.
Okay, cool. Next question from Shivas Ale. How does PT help a patient with hospice care? That's a good question.
It is a good one. So the role of a physical therapist usually in hospice care has a lot to do with making sure that the caregiver is using like safe mechanics whenever they're needing to like help their loved one like roll over in bed, get up, transfer over to the bathroom, or those sorts of things. So making sure the caregiver is keeping themselves safe. Also, some individuals in hospice care are limited to the bed. And one of the big issues when someone is like that is that they can easily get wounds or bed sores. So helping them figure out a training or a turning schedule to make sure that there are multiple positional changes and things like that. And some people go into hospice care before they even get to that point. So there are opportunities to help, these individuals learn how to use a walker for the first time, if maybe they have dementias, and helping the caregivers with cueing. And oftentimes, those caregivers just need that extra support. And so we're there to make sure that, hey, this person is not declining from that movement side of things.
Yeah.
I don't know if there's anything else. Those are the big things.
Yeah, that's a lot of collaboration, I would say, in hospice with OTs in particular, working to make sure people get the equipment that they need. And then usually it kind of stinks to be in a bed all day. So if someone can get up and move, we'd like to help them, and for them to be able to do that with their family safely. So like Alex said, we just help educate and teach.
So great question.
Thank you. Next question. What do you like most about being a physical therapist, and what do you like the least?
You go.
What do I like most? I think that probably the best thing about being a physical therapist is along the way seeing someone progress, but them not recognizing it yet. And, we are with ourselves 100% of the time. So sometimes those little progressions we don't see over time, but being able to demonstrate to someone, hey, you couldn't do this before and now you can do this. And really seeing like how much that means to people and how grateful they are upon realizing like, hey, like I am better. I am doing this. You always have goals and you want to achieve those goals. And it's just really really rewarding when someone hits those goals and they truly, I have some of the most grateful patients and veterans that it makes everything absolutely worth it. So
my favorite part is, I don't know, I like being with people and meeting people and combining that with my love of the human body and like how does it all actually work? 'Cause it's amazing how it all works. Getting to combine those things is really awesome. Least favorite part, I would say documentation, but in my setting in research, I have minimal documentation. It's amazing, and I don't have to justify PT to insurance companies to get it paid for, which is probably the worst. That might be the worst part of physical therapy.
Documentation is definitely, it's something to consider. You're going to spend time, you have to justify whoever's paying for the service. You have to justify to them that that your skills, that your service is needed. So you have to support that with your documentation. And it can be really challenging if you're in a setting that doesn't get a lot of support for financially. If you don't have the resources that you think that the individual or the patient needs. So that can be really limiting too. If you're in a situation like that.
Frustrating.
Very frustrating, yeah. And I think that sometimes, we talk about all these good things, how beneficial it is and how much we love physical therapy. But you do have to consider, anytime you're going into a post-professional school or a post-professional program, you're going to have to consider that this is going to cost you in order to get this degree. And so having the passion, knowing that this is what you want to do and being willing to take on that debt, I think that sometimes we skip over that conversation of, okay, you're going into debt for this and you're going to have to pay this off. I just really encourage people to get out there and do those like shadowing hours and check out all the different settings. Don't just go to one PT clinic. If you really like that one PT clinic, great, but go to others because others might be different and that you don't like. And so there's lots of different options, but you do have to keep in mind that you're going to have to pay off those loans once you're in, for sure.
Cool. How hard will it be for you to pay off your debt? That is also a good question and maybe not something everybody was thinking about.
Yeah.
It depends really on where you are in life. And if you get married, does that mean you have a second income right off the bat to help pay off loans that you can also live off that other income? And it also depends where you go to school, right? It doesn't matter where you go to school. It really doesn't. You're the person that's in charge of your education and how hard you're going to work. So if money is something that is worry and burdensome from you, go to a program that is in-state because that's going to be the cheapest tuition you can find. If there's one where you live and you want to save some extra money, see if you can still live with family or live with, whoever, because that'll save you from having to take out additional loans that you will need for housing and for food if you're not working during PT school. It depends, and of course, there's lots of different ways to pay off loans if they're from the federal government. There's different payment plans you can come up with that you can look into based on your income after school and if you have an income coming in while you're doing PT school, which is really hard, but some people are able to do that, to work at some kind of job during school.
And just like with any profession, when you get onto the internet and you start looking at these things, you're going to see a salary range or you're going to see an average. And I think that it's really important that people realize an average is an average. So when you first get out of school, you are not going, some people do, don't get me wrong, but the likelihood of making the average right off the bat as a new graduate is daunting and is pretty unlikely. So keeping that in mind, that's a goal, if not to surpass that goal. And there's all sorts of different factors that affect how much people get paid, of course, from legislation and how these insurance is reimbursed. That affects your payment, affects your salary. So
what part of the country you're in.
Yes, whether you're in.
Cost of living and stuff like that's always factored in to any kind of pay for a job.
Yeah, and if you can look up these averages, but realistically, it's just asking someone, how much do you make, and being willing to kind of open up that conversation. I know that can be really awkward, but I think that if we were all a little bit more transparent about it, that we would have better expectations for, what is a salary going to look like right after school, 10 years after school. Or what does it look like in the different settings? So if you're in a hospital versus in a skilled nursing facility versus an outpatient clinic, they get paid differently based on reimbursement too. So definitely hard topics to talk about, but it's important that you have those conversations versus waiting till you're out of PT school and you're like, oh, I didn't know about this.
Yeah.
So, yeah.
Okay, thank you for expanding upon that. So thank you guys for your time. We have one more question here we wanted to get to. And has being a physical therapist met your expectations?
Because simultaneous, yes. I can't say that I would be in any other profession that wouldn't fulfill me like physical therapy does. I really do think I'm living the dream with this career, and I wouldn't change it for the world.
Yeah, it's met my expectations. I remember the first day that I treated my own patient after school. I just got in my car after work and I just cried because I was so happy because I was like, I worked my tail off for this and I did it. I saw my own patient. So yeah, it's met my expectations and it exceeded my expectations too, especially during my residency. Had the best coworkers. Yes, we love PT.
Cool. Thank you. Well, that was all the questions we had. I want to thank everybody for submitting their questions. Drs. McKay, Ernest-Stanley, thank you so much for being here, taking your time and sharing your knowledge with everyone and answering these questions. I did actually lie. There is one more question. Now, when I went to a physical therapist, I was told I needed to warm up before lifting heavy weights. In your professional opinion, is that true?
Yes.
Yeah.
Yes.
Okay, I just wanted to verify because I think a lot of people want
It depends on the type of workout you're doing, but you should. You just a little bit active movement.
I would not suggest like standing up off the couch and just taking off in a full-blown sprint.
You save a lot of time that way, though.
I mean, that's true. I wouldn't say get up from your desk chair after studying and just all of a sudden go do a 200-pound deadlift.
Yeah.
You can go
Might want to warm up to that.
All right, this is going to change my schedule, but I think I can take your professional opinions into account.
Good, Kyle. Just like an extra 10 minutes.
Okay. All right. So, hey, Abby Laughlin, she says thank you. I'm saying thank you.
Abby.
Thank you.
All right.
Abby. I work with Abby in the lab. She's the best. She's going to be a physical therapist.
All right. So, again, thank you guys so much for your time. And, everybody stay tuned to see what else Student Doctor Network has going on. Laura says thank you. And again, thank you guys.
Thank you.
Thanks.